World health leaders are warning that Omicron will most likely not be the last COVID variant we see.
A senior official from the World Health Organization says the high levels of transmission around the world give the coronavirus plenty of opportunities to replicate and mutate. Our Chief Health Editor, Dr. Partha Nandi, joining us now with more. And good afternoon, Dr. Nandi. It is good to see you. Many people were hoping that the pandemic would end with Omicron, but that may not be the case. Please explain.
It's great to see you again, Glenda. I wish I could really say that the pandemic is winding down, but that's likely not going to happen just yet. Not good news there. Globally, there have been almost 19 million cases of COVID in the last week, Glenda. That's up 20% from the previous week, and the week prior to that had seen a climb of 50%. Unfortunately, there's just a lot of opportunity for this Omicron to spread, and for then it to cause hospitalization and death. Part of that's because of the low immunization rates all throughout the world in developing countries. The World Health Organization, get this, has pushed for equal distribution worldwide, but that has not happened, right? We have less than 10% of residents in developing countries that have received one shot of COVID-19 vaccine. So these low immunization rates combined with an incredibly contagious variant like Omicron means the door is wide open for this virus to mutate.
So, Dr. Nandi, if no new variant emerges, is it possible that we'll enter the endemic stage? And can you explain what that is?
So first of all, Glenda, what is an endemic, right? Endemic doesn't mean that the virus has poof disappeared. It just means that we're living with it, that it's circulating at lower levels and not causing tons of infections or significantly impacting our way of life. But, and this is a big but, it still causes death because it will find vulnerable people. And back to your first question, which is it possible a new variant, if a new variant doesn't emerge, that for us to enter the endemic stage? Yes, it's possible, but we're really not out of the woods yet. And unfortunately, here in the US, health officials, Glenda, are expecting a new wave of deaths from Omicron, somewhere between 50,000 and 300,000 Americans. That's a lot. Could really die by mid-March. And that's because there's a lag, right? Hospitalization, what do? They follow case numbers, deaths follow hospitalizations. Now, I know people want to think that Omicron, it's mild, quote unquote. And I get that because a lot of research shows that people infected with Omicron are less likely to get sick than they were if they were infected with Delta. That's the truth. However, Omicron still kills people. So now is not the time to relax and abandon pandemic precautions. If we stay vigilant and stay prepared, we can get through this.
All right, Dr. Nandi, appreciate that. Thank you. And if thank you. All right, any questions, coronavirus, you can email the doctor, Dr. Nandi at askdrnandi.com. Send it to us on Facebook or Twitter, and we'll get it right to him.